and ask for acceptance of the minutes of July 20th, 2016.
Make a motion to approve the minutes?
I have a motion on the floor. Do I have a second?
Second?
All those in favor?
Aye.
Aye.
Aye. Okay. Before the board for review, Mr. Sharon?
Yes.
Okay, we have Rick Sharon of Sharon Associates of Rochester, designer for the repair of 21 Silver Shell Beach Road, requiring variances including property line setback on 23 Silver Shell Beach Road, abutter notified.
All right, Mr. Chairman, I did some work on the property, I have to abstain.
Okay.
Okay, good evening, Madam Chairman.
Aye.
We have, this is very similar to a repair that was approved a couple of months back for 14 Nelson Avenue. Similar type system, except this one is smaller in size. This is an existing two-bedroom house. And it's complicated by the fact that we have, well, it's a small lot, 68 by 106, 108 so feet in depth. But you'll see at the back of the lot, we have wetlands in the back. So these are flagged off back in here. In fact, we have a filing with the Conservation Commission, which they'll be discussing Monday evening next week. We're gonna go over that part of it with them. And so it's good we can meet with you all tonight, so hopefully we can go forward with a consensus on this. When we did the perk test, we did 2 perk holes. One in the side yard, you'll see number 1, and number 2 is in the backyard. So one is over here, 2 is back here. Those are the 2 areas where we could stay 50 feet away from the wetlands at the back, at least meet the 50-foot setback. We had markedly different test pits. Test pit 2 was awful. All right, very, very tight, compact material, falling into the hole, lots of water. When we got to test pit 1, however, even though we had a lot of water, we had a very nice cut of sand. We took some of that sand, we did a sieve analysis. So one of the variances that we're requesting is to allow the grain size analysis to determine the percolation test rate based on the approved DEP method. All right, so we followed their policy for that, and we have that information you see in system design data. We ended up with 82.4% sand, which is like a 5-minute perk rate. So it gets us to the highest rate, the 0.66 LTAR that's allowed by the DEP policy. Using that for the 2 bedrooms, we come up with 200, I'm sorry,
110, oh,
we have
220.
220 gallons per day is our design flow rate, okay? So what we're using on this, in order to bring this system down, if you look at the soil log, you'll see in both cases we've got water 24 inches. So we've got a very high water table. Right? So what we're doing here is we're using one of the advanced treatment systems. This is the Elgin GSF, the geotextile sand filter units. All right, these are the blocks that go down. They're all geofabric, all woven together with a pipe over the top to distribute it. We have 2 rows of those. What we haven't done on this, we're utilizing the 2-foot groundwater separation that's allowed within the DEP approval on that product for our repair use, for remedial use. We have no increase here in flow. We're sticking with 2 bedrooms as it is right now, so we have the 2-foot allowed there. That's bringing this system down, but you can see we've still got walls on 3 sides of it, and that's because the final elevation ends up being about 32 inches above ground level, so I'm going to say about in here.
Okay.
Now, Pat, there's a slight change on here that I just picked up on yesterday when I was looking at this. Because we're in a velocity zone, we originally had laid this out with walls on all 4 sides, just trying to keep the footprint as compact as we could because we're so close to property lines. The problem is that the wall facing the beach is where you would have wave runoff coming in a velocity zone. So we've taken that out and replaced that with a 1-in-3 soil slope. So if water comes in, it can wash up into there. So at least there's some, instead of having a hard vertical surface for waves to come up again and
Snap
create
against it.
scouring around the sides, we got something allows the waves to run up the top. They might wash out some of that soil, we have to rebuild it, but that at least gets us within the performance standards of the Wetlands Protection Act in the V zone. So that was a little change from what I'd originally sent in to you, Pat.
Okay, so that's the west wall.
That's on the west wall exactly facing the beach. Okay, so that allows at least the water to ramp up on top. So we do end up about 32 inches above. In this, if you're familiar with the approvals on this, one of the approvals that they have on this and the Presby system is they say that if you take an area reduction, you can never reduce it to less than 400 square feet. Now, we are not taking an area reduction, we're going to full size, so that allows us just size this, just like a leaching field, all right? So that's why we're under, I think we're at, how many square feet have we got here? 340 square feet. But again, we can do that because we're treating it just like a regular leaching field in terms of its area. We're only taking advantage of the approvals on the groundwater separation to try to bring this system down by a foot, so we don't have a much
Right.
higher system out there. So that's what's involved. Naturally, we gotta use a pump chamber to get up into there, so we're putting in a 2,000 gallon tank, that'll be a 1,500 gallon septic tank, and a 500 gallon pump chamber that'll periodically lift up into this system. We do have a low vent on this because we have to vent the air out of the system. But I think I mentioned to you last time, we prefer this to the Presby when we get into raised systems because we don't have to
I
put the high
remember.
vent. Remember? We have to put like a 13-foot tall
Right,
vent,
right.
and nobody wants that sticking out. So this one here, we just put the small vent to release the air when the pump sends a discharge of liquid up in there, and that'll be disguised with a little bird bath cover on top of that, so
Oh,
it won't look industrial.
This is existing home or new home?
This existing,
yes.
yes. Yeah, we wouldn't be able to ask for these groundwater separations on new construction.
Now that bird bath that's gonna be on top of that, that's,
It's just a vent.
okay.
Make it look nice.
It's just a cover that goes over the vent,
Oh, okay.
So it
It's
still
just-
vents out.
Right.
It
with
still
a
allows the
charcoal
air to move
filter
through it.
usually.
but, you know, it protects the water from getting inside of there, and it gives it some useful
Right,
purpose.
right.
So
Okay.
the only thing for the board, other than what Rick has explained, is that there will be a deed restriction for the
Yes.
two-bedroom and
Yes.
for the use of the Elgin, which is required under the,
I'll put those together.
We
and-
discussed that previously, didn't we?
you have seen that many times. The other thing is the local Board of Health approval regulation is for 100 feet setback to any bordering vegetative wetlands. This one is 52 feet. DEP requires 50, so he meets the requirements of DEP, Title
Just not
V,
us.
but not you. So the local approving authority, if you could grant that variance of 48 feet.
All right.
It's about as good as I think we can do with it.
Other than that, you're
Absolutely,
happy
other than a
with-
tight tank, absolutely. I think it's the perfect use for that site. It's a very concise, restricted area that's in use. The soils were consistent from what we saw remarkably to the rear of the property versus the side. This green card that Rick produced tonight was a notice to the abutter where this property abuts and where the septic system will abut. So she's been notified of the requirements and what's being done here, so it meets all the footprint of the law.
Okay. And the owner of the existing home knows that they're, is well aware about the deed restriction?
Yes, yes.
Okay.
I'm fond of
All
that.
right.
So I'll put that paperwork together, and I wonder if we can put that into a single
You
comment,
can, and if you use the format found in Title V in the appendix, it'll cover everything, Rick, on one page.
Okay, I'll try to put that
Yeah,
together and get that into you.
That'd be great.
Like I say, we're gonna meet with
This is part
Concom
of the
next week,
flow
so we'll have a little time before they write things up and
Yes.
get that done.
Sounds good. Any other questions?
Nope.
While we're
Yeah,
here?
ma'am. Okay, then all we need is a motion to approve the 48 feet, right?
52.
48,
Oh,
48
48.
feet, yes. And also all of the variances that Rick mentions, this, using the sieve, the two-bedroom, the use of the system are required by the board.
And also less than 10-foot setback, that's probably the key one.
Thank you, yeah,
that-
to the
that
abutter.
neighbor's sideline.
Right,
Yeah.
right. Okay.
I'll make that motion.
Okay.
All that good notation instead of repeating it.
It's
That's
easy
okay.
when it's in the letter covered by what was covered, yeah. Even I wouldn't know, to be honest with you.
I'll second the motion. All those in favor?
Aye.
Well, thank you. Good, we'll get one more fixed up down there.
Thank
For
you.
sure, and what a difference it's making in water quality.
Oh, it's
We
got to.
see that in the bay,
Yeah.
in Little Bay and here, it's
Mhm.
just amazing with the upgrades. So the Title V inspections are working. Thank you, Rick.
And, let's see, Pat, I did, August 9th, yes, I did 5 copies. Okay, so you have a new submittal with that change in it.
That would be great. I'll
Okay.
stamp all
So
those and
that
get
is
those
good.
ready for you for conservation. Thank
Excellent.
you.
Thank you very much,
All right,
sir.
thanks very
Thank
much,
you.
and have a good
Thanks for
evening.
your time.
Thank you, you as well.
All right, Peter, you're gonna have to get back to work now. Carry you.
Okay, next on the agenda is 28 Scott Street at Title
28 Scott,
V.
yes, it's a tight tank, a 2,500 gallon tight tank. The inspection was done on June 14th by Fairhaven Honeywagon. I was present. The system is tight, does not let any water in. The alarm is working, everything is good. There's no problem with that tight tank.
Alrighty, and then next is the 896 Sconneck Road.
I have not received that report as yet, but that one did pass. As luck would have it, Pete was working in the area and did stop by to see the inspection. I think you concur
Yes.
that what the inspector saw, what I saw, was that it is a
Okay.
passing system. So if that's sent in, I certainly would like not to hold it up. I understand it's a property in foreclosure. There will be an auction for it, and to have that certificate that it did pass would be very helpful.
So we need a motion for 28 Scott Street.
I need 28 Scott Street first.
Okay.
I need I'll make a motion to approve 28 Scott Street, Title V inspection.
Okay, the motion for 28 Scott Street has been made. Do I have a second?
Second?
Okay, we have a second. All those in favor?
Aye.
Aye.
And now 896 Sconneck Road, we need a motion for acceptance.
Yes,
I
please.
make a motion 896 Connect Road, Title V inspection passes.
Okay, we have a motion. Do we have a second?
Second?
All those in favor?
Aye.
Aye.
Thank you.
The floor is yours, Ms.
Okay.
Health Agent.
Ms. Health Agent. What I do have to share with the board, I know at our last meeting, the board discussed an administrative assistant, and we were given information that town administration would be in favor of the board hiring its own administrative assistant. As things shook out, because of union obligations, I did write you a memo. Because of union obligations and advertising for the specific position, that at this time, it's not advisable. So I'm asking your patience and to allow the individual who was interviewed for who applied for the job, there was only one, and who did interview very well for it, appears to be very capable, to accept the position, but it's very different from the past 8 years, where the administrative assistant worked in the building department and as needed would enter the Board of Health. It is now that there are dedicated hours to the building department in the morning from 8:30 to noon, and then from 1 to 4:30, they are with us. The individual is Paula Medeiros. She came from the assessor's office. Very capable, very interested. I'm actually excited about having her here for the time that we have. I don't know how this will shake out long-term, whether or not the Board of Health will be back looking to hire its own administrative assistant over time, but for right now, it will work very well. The only problem is the office is not set up for it. It's been 8 years since we've had anything. If you went in there, you notice I tried to move things around to make room, but there is no phone, there is no computer. I have to say, I'm not getting much assistance in getting those things. I'm
Okay, so
working with administration. I wouldn't mind a call, if you don't mind.
I was gonna, that was my next
thank you.
question. I was gonna ask.
I'm
what
working
was
with Ann
the-
O'Brien, who's been in the selectman's office. She's very diligent, but there's a lot on her plate. And, I really would like to accomplish this. Unfortunately, the burden of providing, like, the phone line, which is at its max, I understand whether or not it's doable. And the other thing is the computer, that the Board of Health has to bear that burden of providing the computer and the cost.
Well, my question regarding the phone, I mean, we should,
Had one before.
yeah.
But the phone system changed from 8 years ago till now, and there's only, from what I understand, I may be incorrect, but the phone system only has a certain number of lines, and those are maxed out, and I don't understand why my line can't be split. It literally would be the same line. You don't need a separate extension. We can still use that 125, whether you reach Paula or you reach me. But Ann is working very hard to accomplish those things, but it certainly would have I think, a depth of support from the board to make that known to the rest of the administration, if, you know, if you want to speak with Mark, that the need is there. Because I really can't do much with Paula without the phone or the computer to set things up, so, but
The shared phone line wouldn't even be an issue because
it shouldn't be.
it would be her responsibility to have the phone
Exactly.
from the 1 to 4:30.
Yeah, and not to have it on the health agent's desk. The food inspector, Tom, doesn't have one. We share my line, you know, physically. So I'm hopeful, but I haven't had a response, and I made that request on, I think it was Monday, in writing, email. So I certainly would welcome the support to get it moving, because I'd like to see things begin to change. And I think she's capable. I've seen it in just one day. She started today,
Mhm.
as a matter of fact. And in your packet, you have the, on the bills, you have the change of status for her, from where she came from the assessors as a senior clerk and now to an administrative assistant here with Board of Health and Building. So there's, you need to sign that. So it's beginning, but, and I'm hopeful, at least for the time, until I see how the building department's use is, and then we can discuss it further, but, so.
I like the idea of the designated hours,
It,
so we can,
black and white,
for
it is
lack
so
of
wonderful.
better terms, get our money's worth.
Right, and it's
Yes.
nice that Ashley's gonna cover the building department instead of having Paula.
That's
pull to
my
cover.
understanding. When Paula isn't there, Ashley from the Selectman's office, who does Blue Cross, will be covering for Wayne in a pinch, so in the building department. So we think it will be working right now. You know, we'll see how it matures, if you will, but I would certainly welcome the opportunity to share what I know, and certainly, or what the needs are of the Board of Health, and certainly before the permitting season comes up and the flu season comes up, so it's good
Fast
timing.
approaching.
It's fast approaching, it's good time. So the office is crunched, but we'll figure that out, it's just logistics, so the help would be
Done
great.
Before we can do it again.
That's right. It's just been 8 years. It's a long time and a short time at the same breath. A long time to go without something and rely on
Mhm.
another method. So I'm happy to start, but a little anxious about doing it right. So there you are. The food established inspection log, there isn't much to report to you, to be honest with you. There were a few inspections done, not many complaints that we aren't handling. The beaches, the marinas, the tobacco control have taken up some time, and they're all good. But it's only been 3 weeks since we last met, so there's not a whole lot to report.
Weren't we supposed to have
Yes.
somebody in front of us?
You were, but to be honest with you, we had a long discussion and got very
So the
involved, and they
situation-
have asked for, they have control on the situation, have asked for a longer period of time before that discussion takes place.
Okay.
And to be, you know, give it all fairness, I just thought, I'm sorry, I forgot all about that. But in all fairness, I thought that it would be appropriate to wait and see what the outcome of that promise is,
Okay,
that they would jump on it, so thank
that's
you.
fine.
Household Hazardous Waste Day was Saturday. I think I texted you all that it was a phenomenal outcome. We usually have 120 to 130 max. Since 1989, every other year we've done that. There was one year that we did it like year after year, but it's been every other year since 1990, to be honest. And we've never run out of money. This year we did. We had 185 households participate. We did run out of money. The company, it's the second time that we've used this company. It's been a lot of years in between. They were a little bit slower and unprepared because we had forecasted 130, 185 showed up, and the line never stopped. And as luck would have it, Pete showed up to help that day. Thank God, because without it, it wouldn't have worked.
The line was so long, it was all the way up to Stop and Shop. So the problem is, you got the recycling coming in and then hazardous waste. So I had them put the hazardous waste in one line, recycling, skip through to the back, and that brought the line better.
So it was
But
all
at
in the
one-
same line.
She was at one end, I was on the other next to Route 6, and we were just coordinating It was crazy.
It was crazy.
It was
And,
crazy day.
and we haven't seen a crowd like this, and I understand there were 3 reasons in speaking with the people. One was the household hazardous waste sign, that we put on Route 6 through the BPW went out a week earlier. So it notified people and gave them an opportunity to get that ready. We did all the same advertising. It was in the newspaper, and it was on TV, and it was on the website. Then I heard from a couple of women who had called in that they had put it on their Facebook, and it just spread like wildfire. And another woman told me that she had heard from the Buzzards Bay Coalition, who did, quick speak on the radio that morning, get the stuff out, get going. So we were overwhelmed. It's just 2 years ago that we did it, but it's a changing landscape, if you will, for social media, and certainly that needs to be addressed at the next event that you have. So my thought is, I know it's a ways away, but if you can store it somewhere, my thought is that you may wish to have people pre-register, and they may come from like 9 to 10, 10 to 11, and 11 to 12, so that it's more controlled, doesn't back up onto the highway, people are better served, you can calculate better what your needs are. And then if you allowed for a contingency, say 10% of people coming in. Other communities locally, they actually pre-register like that, and the individual pays for the service based on the carload or half carload amount. So it's a cost avoidance, but I think in the past, both the Board of Health, Finance Committee have felt that it's a service that townspeople deserve.
Right.
And not to take that away, but that's for another day. But those are options, especially now with computers and everything, with Facebook and all of that, Twitter, all of that stuff, that you could get that out there. You need to pre-register, and you might have 50 per hour or something like that. That's very manageable. But that's for the next one. The company we had was slow but thorough. They took all of the waste. There was an exceedance of waste that they could not fit in the vehicles that they brought, so they picked it up on Monday. The charge is over what we opted for, but of course it's waste generated here, so we'll do that. And I have had assistance in looking for that funding through our own budget, through the town administrator, and through the fire chief as a last resort to help, because he has a hazardous waste fund as well, yeah, but it's for a different type of use. So the funding is there, the need was real, and I think we did a good job, actually. I mean, we were
Great job.
exhausted.
I was tired.
And people were not happy, but once we took them in, they relaxed and they were happy, and we took every car. So that's my report on hazardous waste.
Thank you for being there.
It was-
Yeah, it was luck of the draw, that Pete showed up. I mean, really, Pete, I couldn't believe that you remembered, and, 'cause
Put it on my phone.
my own fault, see, there you are, there's the media. My own fault, I didn't
We were away.
remind
yeah.
each of you, because I was just too busy, so this worked out, God's hand. But, so to change,
I met so many people in line, people I haven't seen for years. It was good chit chat.
You like that kind of
He-
thing.
Not you.
I liked it.
Yeah.
no, not Pete, you're
Yeah,
an
it was great.
introvert, yeah, anyway. So that worked out well. The last thing, it's not on the agenda, not on the menu, but I do want to say that I was asked to participate in a regional meeting by Bristol County Mosquito Control. And today we met with Bristol County, with DPH, and Division of Agricultural Resources, a veterinarian service that handles mosquitoes. City of New Bedford, City of Fall River, Dartmouth, Wareham, and myself were there. And what it is this, that the mosquito control, as you know, they trap mosquitoes. They check for the type of mosquitoes that they're looking for. And they have found a trend in a particular type of mosquito that is moving north. It is called Aedes albopictus. It's related to Aedes aegypti, which is the vector for the Zika virus down south. They're not sure about the capabilities of the Aedes albopictus to transmit the Zika. First of all, you have to have a population that has the Zika in order for the mosquito to bite and spread to the next, and it's not here. So there's no heightened public health issue. But this particular mosquito, the albopictus, is very aggressive. It bites during the day, and it bites hard. And it's not unusual to have a welt, a very large welt.
We seem to have a lot of that in this area.
But I can't say that it's albopictus. The last time they picked this up in Fairhaven, there was only one, and it was in 2011 in all of their screenings.
Really?
However, they've seen some in New Bedford, and some, 1, 3, pick a number, because they never divulge that.
Right.
It's just that we have it. It's some in New Bedford, Fall River, Wareham, I think, had one, Dartmouth and Fairhaven, and that's why, and Westport, and that's why we were invited in. So it's the same message that we need to get out for the Culex or any other mosquito that's here, or any other mosquito-borne illness, West Nile virus, Triple E, any of those, that we need to get rid of excess water. Tires particularly, this mosquito doesn't like a large amount of water. It comes in tire rims. It likes little pools of things, like you have a bag of trash that's sat there for 10 days, and on that black bag is a little pond, a little inch of water. That's what it likes. So they're trying to focus on that, and as a result, the DPH, Department of Agricultural Resources, they're teaming up together with their message boarding, and they will be blitzing the South Coast about getting rid of these water and these issues. They don't feel that the albopictus has flown up here, though it's state by state. It's very prevalent in New Jersey, and so it's coming. And we need to prepare, just like West Nile virus, Triple E, we need to prepare and get ready. But it's just an aggressive pest, and if we can eliminate it now, it will do so much wonders later for any disease-bearing issues, which they don't have now. But what they have found in their studies is, and this is mosquito control, both Bristol and Plymouth, and the agricultural resource, is that they think many of these mosquito eggs and are coming in tires that are being brought in to many of these places, and we have 1 or 2 in town that we need to visit, and as a vector control to let both Bristol County and agricultural resource know, so that they can be sprayed, so that they can be maintained, so that there's better quality control. New Bedford has some, Fall River has some, West, we all do. There are issues amongst us. We're not different on this case. So that was the thrust of the meeting, was to prepare us for the public information, the questions that follow. Where is it? Do I have it? Just like West Nile virus when we started. It's here. Prepare. Take better care of your property. Empty the bird baths, every 7 days. All of the logical stuff that we did in the beginning that we've become immune to over time, because we've heard it so much, but now this is a new vector. And I heard of one particular area that an owner of the property called for mosquito control to go in and check the area because their child was being bitten so badly, and so one of 3 children, just one, was being bitten so badly that they actually took the child to a pediatrician thinking it was a rash, but it was bites from this mosquito. And they're small things like the corrugated downspout and the water that sits in that, that's what the eggs love. And in many of the trappings that they're doing, mosquito control, they're finding only the eggs and not the adults. They haven't been able to trap, and they're using 3 or 4 different types of traps. So the
That's
general
interesting.
information, yes. Well, they're thinking they come from these tires or other things that are imported from down south
Right,
where
right.
they're better breeding grounds. But there isn't.
So the eggs are already planted there, just
There you
waiting.
are, and they're waiting, and some of them can overwinter. Of course, at this point, we're all hoping for a very cold New England winter and snow and that it will but these
I didn't
albopictus,
know that they were able to survive through.
some do, some over, not all, not the whole population, from what they said. But also, these mosquitoes love humans, absolutely love, that's your blood meal. Others not so much, but this one loves a human blood meal. They go by the carbon dioxide that we off-gas. They love entering into houses where people live, so it's really important to try to take as much habitat away as possible. New Bedford did have some hits on some of the egg traps, and so they're going to be sprayed, particularly in those areas, but it's ubiquitous, it's coming, and we just need to learn how to take better care of ourselves and the environment.
With all of the salt water, and then we have a lot of like marsh, because it, goes out with the
Will
tides.
not affect that, it's fresh water.
So
that
only
they
fresh
like.
water, right?
Yeah.
They have no attraction
Yeah.
to salt water whatsoever.
I can't say whatsoever, it's new to us, and we're learning, but the mosquito
Traditionally?
control, yes, is more concerned with the fresh water.
Okay.
So things like, I said, like tires, like the bottom of, they don't like big water. They don't like pools and bird baths, from what I understand, but they like bottom of kids' toys, where there's a little residual, even just the corrugated downspout, that stays wet and it's there. So there'll be lots of public education coming on this.
It's funny that you say that, because I just learned something new over the last couple of weeks. My daughter went in my bedroom and she said, "Mom, you have creamy baby oil. I'm stealing it." The one from Virginia, and I said, "Well, what are you talking about? Why you have a baby? Why are you stealing my I forgot mine. It's the best mosquito control ever.
Yeah. I've heard that too.
I never knew
But
that.
they still want you to go with the DEET,
Yep.
always the DEET.
Yeah.
The others, they're just
But
not
I guess
well
for
founded.
the little babies
Yeah.
that they don't want you to use
Ah.
the DEET on,
Could
they
be,
use that creamy
Creamy baby,
baby
yeah.
oil.
but all of the information will be forthcoming on that, so
Good.
when it comes, I certainly will forward that to the board and make that public as possible. I'll work with Ann O'Brien and get that on the web for other use. So if you see that our area is being bombarded, it is not that it's here and we're all gonna, no, it's that we need to educate, we need to clean up again, we need to get involved, and, what else? It's called the tiger mosquito. So if you hear the tiger mosquito, it's the Aedes albopictus. And it's very interesting because the way they described it, the mosquito that really is shaping the shape of Zika in Florida and southern Texas is the Aedes aegypti. That one they described as like being a buffet eater. It's like, oh, a little of you, a little of you, a little of you. And that's how the disease is being spread. The Aedes albopictus likes a restaurant. It's going to sit and it's going to eat. So there's a different lifestyle, but still it's capable of carrying the dengue, the chikungunya, the Zika. And none of those are really
Sounds so African. the
I know, right?
chikungunya.
I love chikungunya. So it's none of those diseases are prevalent here. You need to have a population infected with it in order for the mosquito to carry it.
But all it takes is one.
A number of ones, but you're right. So,
Do we ever
anyway.
have a West Nile case in Fairhaven?
No, not that I'm aware of, no. And I haven't heard of any good here
And the good
either.
thing is we're televised, so
Hopefully people will
Whatever.
listen, but
public is watching.
the public education from the state will be broadcast I think we all decided as health directors and health agents that tell the truth, be honest, and inform. And
Now,
that's what this will do.
Are they gonna provide us with some information for the public that we can
Oh,
hand
yes,
out?
yeah, there'll be lots of, you know, things that they will send to us and that we will make available. And I know New Bedford was looking for some door knockers, that might be of interest to different areas of the city and stuff to capture that attention. And I think that would be very lovely here as well, so. And the intent really, there is no Zika here. And the intent isn't to frighten of that, but it really is to begin to maintain so that it stays that way. Hopefully, we can begin to
You know,
get rid of those habitats.
talking about door knockers, you know, we had that man in here on our last meeting. Would that be something that him and his group that he
It might be,
oversees?
it might be.
You
Yeah,
wanna get-
I've got his number, yeah.
That might be something to look into. I mean, that's,
Yeah, when we need the help, absolutely.
Would,
Right.
would there be funds available, or does the Neighbor News allow for some type of just informational, instead of having to pay for it if there aren't funds, but maybe an informational to get out to the townspeople?
You know, we're hoping, because we feel as health agents and directors for the towns that this is all related to the Zika, but, to the Zika virus. And there are funds that were made available to the state, whether or not the state views it that way, because I know there's a huge thrust for laboratory work and, you know, for analysis, for people asking whether or not they have the disease and things, and maybe the money will go there, I don't really
Maybe even
know.
like a letter to her paper. I know that some people write letters, informational letters, or have her come to a meeting where we're gonna discuss it and she can cover the information so it gets out that way if there aren't funds to do
I
a
agree,
publication.
yeah, I know,
When we're ready, you know, not.
yeah, Dr. Valancourt, who is the health director in Fall River, did write a letter to the editor that was on target and very appropriate for what they're doing. And I think it has
is that
universal,
to the Standard Times.
that was to the Fall River Herald.
Oh, okay.
Yeah, and I'm sure it will be picked up by the Standard, and I understand that Dr. Weiss in New Bedford Health Department, that she mirrors that kind of messaging whenever New Bedford has spraying. So, I mean, we spray here, but we don't advertise it.
Right.
Individuals call in to Bristol County and it's sprayed.
They've sprayed, I think, 4 different times already in New Bedford. Possibly
That they,
more.
right, that they notify on. We have, in Fairhaven, we have asked for our parks. We have asked for here, where, where they have the music on Thursdays. We have asked for, the baseball field, the soccer fields, things of that nature, and those are done consistently, but we don't advertise, so, and individuals can still call in, and ask for their properties to be sprayed, but, you know, it's an individual community approach. Here, it's just simply done. Other places like New Bedford and Fall River, apparently, there's, more of a different movement, if you will. So that's where we are. It was very interesting. It's wonderful to do something so cohesive. You know, you work so hard in the community in which you live. As a health agent, there's a myriad of things that you do in the day. And most of them are complaint and people aren't happy. So when you get to work on a project that's regional and has a positive outcome, and you get to share those aspirations and goals, it's very unifying to know that we're kind of all struggling towards the same thing for all of the population, so it was interesting. So I'll keep you noted. Whatever comes our way, we'll share.
I'm sure it was quite interesting, because
It was
what you just
very
said was-
interesting. The science of it is fascinating, but little devils. So what else do I have? Just the invoices there.
Can I use your pen?
And I have, I had a half-day on Monday, and I would like to take the 19th to go see
Oh.
Jade.
Sure.
All right.
And the 21st, because it's Grandpa's 85th birthday.
Yeah.
Mhm.
And those are my last 2 days from last year. Ooh, and today is my 35th anniversary for working for the town.
Really?
Like-
Wow.
You're an old
We appreciate you.
Oh,
Did you get a message to remind yourself, or?
Yeah, I just did now. It's like, hey, by the way. It has been a privilege, I must say. It has been an absolute privilege. Not always easy, but always a privilege.
Change of status, how many signatures you need?
Paula, I think the whole board would be good, if you don't mind. You can see the change in the rate. ABC, because we have to do the warrant like that, the billing, each ABC bill has its own space on the line. Before, I would combine them, so you'd have your monthly contract and whatever roll-offs, but now, because they want the invoice number, it looks more than what it is. ABC is moving along, so I'm still cooking.
You have no, folder?
No, not this month. Either that or I forgot, but thank you for remembering.
I have a quick question. It's just an informational one for me.
Absolutely.
How did we come up with our pest control? How did we choose A and M?
Ah, so interesting. How long have I been here? 35 years? They were here before me.
Okay,
So there's no contract per se, but, they have always,
so it's just a status
it
quo.
has continued, and, no one has asked for a contractor anymore. If you would like to choose something else, look at options, the board certainly may. It's your
Well,
contract.
I was approached and asked,
Uh-huh.
You want us
We-
all to sign the change of status? Sorry.
Pardon?
The change of
Yes.
status, you want everybody to
Yes,
sign?
please.
Just me
Um,
over.
So I can't
Yeah,
really
anyway.
answer that, Janine. It has always been, even when I came, they were here.
right,
And the sun carries on now. They're always there for me.
Mhm.
Whenever there's another issue, and there always is, he always does show, always does come, doesn't generally charge, other than that contract fee. And keeps us abreast of any issues and problems, like at Fort Phoenix, with all of the users in the trash there. So he's been extra careful in watching that and making sure there's no evidence of any further
right,
infestation.
right. I didn't know. 'cause,
No, feel
I
free.
mean, there are a few others in town, and I
Yeah.
didn't know if,
Yeah, and
it's
there's a
never
few
been brought
homegrown,
up,
no,
so.
and it's just the way that it is, but if you wish to change it, certainly it is, or question it, we can certainly.
right, right, I was just
Yeah,
curious on how that could,
that's all that I know. So at your next meeting, Paula will be here.
okay,
She will start taking the notes. I will work with her on the minutes, and we'll get her into that gear. And then the time that she spends here will be comp time in our office following that.
perfect.
Okay, as long as you approve, I'm
That's
good.
very exciting.
I hate to give up that
Long
job,
overdue.
but I love it. Yeah, I'm ready.
Yeah, but you know what, you'll be here too.
I will be, yeah. It'll be a good relationship. She's lovely, I have to say.
Just one more to add to the bunch.
But down the road, we gotta think about full-time position,
Oh,
down the road.
without
That's,
a
that's our,
doubt.
that's our goal.
You do need to get everything
Yes.
back online, I agree.
Online,
Yeah,
no.
we're not the only office that was stripped
Right.
through some financial difficulties, but now it's time to regrow it, yeah. And so you can outreach and
Mhm.
do more hoarding issues and
Yes.
do more,
Education, to schools, we
Education,
used to do education
I mean, the
schools.
recycling itself, the
Recycling, we did-
environmental stuff, so,
We
yeah.
did so much more, but now we so understaffed.
Well, maybe that will change now. It looks like it will.
Yeah.
That would be nice. Okay, If we're all done with our business, I need a motion to adjourn.
Make the motion to adjourn?
Second?
All those in favor?
Aye.
Aye.
Ooh, another meeting?
Okay.
You wanna discuss that later?
Texas, yeah.
I brought my calendar